Hello, this is Dr. Arpita Dev. I am a consultant gynecologist and IVF and infertility specialist, currently working at Indira IVF, Asansol branch. So, in today's video, we will be talking about preconception counseling and care. As the name suggests, preconception counseling and care is the counseling and care which is provided prior to women becoming pregnant. Now, in India and also abroad, most of the pregnancies today are unplanned. So, this unplanned pregnancies has become a worldwide problem, and this results in many complications and adverse effects which are otherwise preventable. So, here comes the role of preconception counseling and care. It is rather an opportunity for a couple so that the lady enters pregnancy in an optimum state of health so that pregnancy outcomes are good. Now, the next question which comes into our mind is, who are the couples who need preconception counseling? As a rule, all couples need preconception counseling and care. But it is more important if there is some chronic medical disorder, any history of prolonged medication intake, if BMI is not proper, like if she is underweight or if she is obese, or if there is a family history or there are any significant obstetric history like recurrent miscarriages or previous history of intrauterine fetal death, etc. So those are the couples who need preconception counseling and care more than others. Now, what are the parts of preconception counseling and care? First is a detailed history from the couple. Next is physical examination. After physical examination, we advise the couple to undergo some routine tests. These tests include complete blood count, blood grouping, thalassemia profile, rubella antibody, and then kidney function test, liver function test, pap smear, etc. So after these investigations, if a couple is found to be non-immune to rubella, she is advised to get vaccinated for rubella. Now, this rubella vaccine is a live vaccine, and after getting vaccinated, she should avoid pregnancy for some time. Also, if she is not vaccinated for hepatitis, she can get vaccinated for hepatitis. Now, next are some interventions if it is needed, like to start few medications like folic acid. We have to start preconceptionally. We might have to stop few medications, or also we might have to change few medications to more pregnancy-safe options. Also, if a couple or lady needs endocrinological or cardiologist workup, so we do that during the preconception counseling part. So after that, we'll also explain the couple what can be the risks and complications in her case. We educate the couple about the trimesters and what happens in the 3 trimesters and how she should be during the 3 trimesters. How much amount of physical activity is allowed, what diet she should take, what is the restriction of intercourse, what is the restriction on outstation travel. All this we educate the couple. And also, one major part of preconception counseling and care is that we also tell them about prenatal diagnosis. That is, if there is an advanced maternal age, we must rule out aneuploidy, and for that she might get her embryos tested. That is, she might do PGTA for the embryos, or if there is some known genetic or chromosomal disorder in the family or in the previous sibling, so they can get tested for that also. So these are prenatal diagnosis options. So after that, we'll counsel what to avoid and what not to avoid. Like, she should avoid over-polluted places, over-noisy places. She should avoid totally any forms of active and passive smoking, alcohol, any drug abuse. She should minimize her screen time. That is, minimize the usage of mobiles, laptops, tablets, etc. Okay. So, in short, this is about preconception counseling and care. If there are any further queries, you can visit the nearest Indira IVF center and also contact the helpline number. Thank you.